While we're in the middle of this Omicron-fueled surge, of course, many more of us are getting tested for COVID and testing positive. So what do you do if this happens to you?
We are joined live now by pediatric infectious disease physician at Oregon Health and Science University, Dr. Dawn Nolt. Good morning.
Good morning. How are you?
Doing fine. What is the first thing that someone should do if they do test positive? It seems more and more people are testing positive these days.
Yeah. If you test positive, or certainly if you start to feel ill, then you should immediately isolate yourself. Find a room in your home that you can stay by yourself. If you're at work or somewhere that you are around people, please leave and go home and isolate yourself.
Dr. Nolt, we talk about this surge in the virus, and I think early on, that we're 2 years into this pandemic, people kind of immediately thought that they needed to go seek care. Well, now people need to stay at home first. So when should people, though, go to the doctor or go to a hospital? Because obviously those places are at capacity.
Absolutely. Our hospitals are really stretched and overcrowded. So a lot of people with COVID-19, the vast majority will get better just staying at home, resting, hydrating, taking some Motrin or Tylenol to make yourself feel better. But the warning signs that you should call your doctor or go to the emergency room would be if you start having difficulty breathing, you have some chest pain, you start to get a little confused, or if you're resting, it's hard for you to wake up or stay awake. And if someone sort of looks at you and says, you look really bad and really pale, those are probably some signs that you should call your doctor or seek care.
We're also in the flu season right now. So is there something we should be watching out for to differentiate the flu from maybe the COVID?
Not so much. Both of these are respiratory viruses, so they both present with coughing and sore throat, sneezing, and fever and fatigue. So if you feel sick in any way, really test yourself for COVID first. And if that's negative, then you probably have the flu, and I would talk to your doctor about measures after that.
And talking about other precautions, if someone's child tests positive, do the rules change at all as far as what precautions you need to take?
Well, for children who are very young, it's a little hard to put them in their own room by themselves for several days. So as you take care of that child who's sick, you as a caregiver or others around you in the household, please wear a mask to protect yourself. Wash your hands really well. Try not to share anything like towels or plates or utensils with that child, and really just, love them, and they'll get better pretty soon.
We're talking about testing positive, but recently there's been trouble in terms of getting tests, both at-home tests at the stores as well as going out to a testing location. What are you hearing now? What's the situation now about me being able to just go get a test in the first place?
Well, there are places. So the first thing I would do is try to call your doctor and see if there's a test at the place, or look online at state public health websites to see if there's a testing site there. And you can always try to call some of the stores or look online to see if they're at-home tests. They are pretty scarce. So if you feel ill, the first thing, as we talk about, is to stay at home and take care of yourself and assume that it's COVID, because that's really the circulating thing at this time.
Yeah, Dr. Nolt, thank you for joining us this morning on AM Extra.
Thank you so much for having me.
I appreciate your time. And we do have plenty of resources about the coronavirus pandemic, including information from the CDC, state health authorities, and vaccine clinic locations. You can find it under the coronavirus tab on our website. That's coin.com.